I know a lot of the focus is to, like you talked about, spine power is probably something that we just want to avoid. Obviously, some activities you just can't prevent them, and so transfer a lot of that load and that power to the hips, right? But what's the consequence of that, I guess, on the knees, and is there one? Because we're hearing more and more, I guess, in the more mainstream public about how we need to let our knees not be so restricted, let them go over your toes, and not have, not just simply rely on that hip hinge, but just, let some of that transfer over to your knees and let them go beyond your toes. So just wondering about that interaction and whether one is of consequence to the other and that sort of thing.
Yeah, well, let me narrow down the discussion a little bit so I can
Sure.
be more specific. If we leave it too broad, then it's hard for me to make some specific comments. But first of all, loading at end range for any joint is an issue, whether it's the hip, the knee, or the spine, because at the end of the day, you're going to be loading the passive tissues quite a bit. So as we get to end range, everything starts to stretch, our muscles stretch, the length-tension relationship between the muscles is at its maximum, and so we're getting a lot of passive muscle force. We're also getting the ligaments and joint capsules starting to stretch and respond. And the cool thing about the hip is that for a lot of us, even us guys with Celtic backgrounds, which we can talk about, differentiating them from someone with an Eastern European background or an Asian background, still have a lot of range of motion in our hips, and usually more than enough to do, say, rotational sports like golf or baseball with quite a bit of hip power, and still nowhere near end range. And so when you're loading a synovial joint through its normal range, it's relying on active muscle strength and stiffness. When you start getting to end ranges, you'll see on different social media accounts, well, it's okay to bring your knees to your chest, or get a maximum hip flexion, disregarding spine posture and all that, or go in and do some deep squats and put your ass to grass, as they commonly talk about. End range knee flexion, going after full calf on thigh contact. The lab just down the hall from us, after you left Waterloo, there was some knee biomechanists coming in trying to model how that actually pulls the joint apart and stretches the capsule even more, because now there's a fulcrum between the calf muscle and the thigh muscle, and the knee pries itself apart. And so there's a lot of mechanisms that are starting to become understood, and there's definitely a lot of mechanisms that we do understand that says end range loading is probably not a good thing at nearly any joint. And so that's sort of a general comment. But more specifically, if I take an example of a trade-off between, say, a front squat and a back squat.
Right.
The line of drive shifts between the front squat and the back squat, but so does the distribution of load and force, because as you migrate the load further forward, you may take some stress off the knee, but you're now putting it on the hip and the back through an extensor motion. Whereas when you're in a front squat and you move the line of force back and you sit a little bit more upright with your body, you decrease the moment on your back and hip, but you increase the moment on your knee. So there's a trade-off with everything. There's never going to be a win-win scenario. You're going to optimize something. You're going to try to minimize both or maximize one and minimize the other. And again, it's not that the front squat or the back squat is a preferred exercise for everyone. There's specific reasons to have a back squat or a front squat, and whether or not you want to develop hip extension or whether you want more knee extension, it's very sport and situation specific again. Another example of that interconnection between the knee and the hip is with female athletes, particularly basketball and volleyball and soccer, with non-contact ACL injuries. In basketball, the rate of non-contact ACL injury, if you have a controlled study and look at NCAA men and NCAA women, they have as much as an 8 times greater incidence of non-contact ACL injuries. And that comes down to a difference between the neurological patterns that activate glute versus the quad. And if you get your knee in what we call a dynamic valgus position, so the foot points outward relative to the knee and the hip, you think of it as a hockey stick, if you can visualize that in your mind. If that knee moves medially towards the inside and the foot's planted on the ground, you're now creating a large bending moment around that knee. If you go ahead and activate the quad first, you're going to stress the ACL ligament. However, if you externally rotate, as you brought up with the glutes, and activate glute max and align the knee and then create the extension through the knee joint, you will bring the stress off the ACL joint and into the muscles. So you mitigate the risk for an ACL injury. So the downstream isn't always upfront and obvious. And I think that's where a lot of this online presence of online training fails to go down that road of, well, what's the long-term effects of what I'm recommending, and having, broad-facing opinions on. If I was to tell everyone they could benefit from one exercise, it would probably be walking.